Hi madam, my name is Racheal Williams from DPH Cohort 15. So this is my poster which I've made for eczematous disorder, and this is the type I've chosen, which is occupational dermatitis. So first of all, I wanna explain a little bit about the introduction. So occupational dermatitis is a type of contact dermatitis. It is a contact dermatitis type caused by exposure to an agent at the workplace, and it is a dermatological disorder which is commonly occur at workplace, which is called as also an injury. Workers in many occupations are at increased risk of developing dermatological skin disorder. So this is one of the kind due to the chemical and physical hazard in the workplace. Contact irritant dermatitis, it can affect or adverse the health effect on workers and may cause permanent scarring on their skin and also disability. And this is the risk factor reason for occupational dermatitis. So the first one is substances that found in the workplace that come in direct contact with the skin. And then the kind of chemical is acid bases, fat dissolving agent, and also the amount and the concentration of chemical coming in contact with the skin. The amount also will be considered, will be in count. And then the length and frequency of the exposure, like how long the chemical exposed to the skin of a worker at their workplace. And also the environmental factors. So the next one is the sign and symptoms of the occupational dermatitis. So the first one is redness of the skin, scales, blisters, and crust. And moving to the next one, actually there is a several type of eczematous disorder. So I have chosen the among ADAS type. So this is the types, 7 types of eczematous disorder. So the first one is atopic dermatitis, and then the second one is contact dermatitis. So this is the one I have chosen. And third one is dyshidrotic eczema, and following hand eczema, neurodermatitis, nummular eczema, and statitis dermatitis. So the reason I have chosen the occupational dermatitis is because one of my family member also have been affected with the same dermatitis, which is occupational dermatitis, at their workplace, when they have to deal with chemicals. So personally I have chosen this, as I also see my own this condition has happened to my family member. And for the counseling of patient, the patient should avoid taking too many showers or baths, as it may worsen the skin condition or make it even dry. Avoid scratching or rubbing the skin or scratching. And then use hypoallergenic cosmetics. It means anti-allergic cosmetics. And the patient should also avoid activities that make the patient sweaty. It means the patient should avoid any kind of activities that make them sweaty, which may also worsen the condition. And the patient should also learn how to handle the stress, as stress also may worsen the condition. And for the next one is recommendation for treatment, such as this one. This is the recommendation for treatment. So the first one is avoid the substances causing skin irritation, and then use cold compress and keep rash covered to prevent it from scratching. Take an oatmeal bath. The patient should also moisturize often with the body lotion, and the patient also can try OTC therapies such as hydrocortisone cream, and use humidifier. And lastly, the patient should also consider eating healthy, so it may control the condition of their eczema. And for the guide on using the products, there are several types I have chosen. So the first one is Aveeno 1% hydrocortisone anti-itch cream, and cortisone 5 cream, cortisone 10 ointment, corticool anti-itch gel to make it less itchy, and cortisone 10 plus. So the last one is the references. So these are the websites I have chosen to make my poster. So these are the references: Skin Health Institute, Einstein Med, and hac.gov. And that's all, madam. Thank you.